Have you ever woken up tired even after a full night's sleep and wondered, is this just aging? Or quietly asked yourself, why do I feel heavier every morning even though my tests don't look that bad? I'm Dr. Mark Ellis, and I need to tell you something urgent. For many adults over 50, especially those managing blood sugar or blood pressure, kidney damage doesn't begin with pain, swelling, or dramatic symptoms. It begins silently with everyday food choices that seem harmless, even healthy. And by the time warning signs appear, the damage is often already underway. What's even more alarming is that some of the foods people avoid out of fear are not the real problem, while others they trust may be quietly overloading their kidneys day after day. In this video, I'm going to show you a clear, practical way to protect your kidneys using familiar foods explained simply so you can act before silent damage turns into something irreversible. Stay with me because this may change how you look at your daily choices starting today. After hearing how silently kidney damage can begin, most people immediately think the solution is to cut things out, fewer foods, fewer fruits, fewer options. And that's exactly where many well-intentioned adults make their first mistake. Because one of the most misunderstood fruits in kidney health is also one of the simplest, guava. I remember a patient in his early 60s who told me almost proudly, "Doctor, I haven't touched fruit in years. I'm afraid of sugar." On paper, his blood sugar looked controlled, but his digestion was sluggish, his inflammation markers were creeping up, and his kidney filtration rate was slowly declining. Nothing dramatic, just that quiet downward trend so many people miss. When we look closer, the problem wasn't excess sugar, it was what his body had been missing. Guava is often avoided because it tastes sweet, but nutritionally it behaves very differently. A single serving of guava is packed with dietary fiber, which slows glucose absorption and prevents sharp blood sugar spikes. It's also one of the richest natural sources of vitamin C, a powerful antioxidant that helps reduce oxidative stress, one of the key drivers of micro damage in kidney blood vessels. Research consistently shows that diets higher in fiber are associated with better glycemic control and lower inflammatory markers, both of which directly reduce the workload placed on the kidneys. When inflammation drops, the tiny filtering units inside the kidneys don't have to strain as hard. Over time, that matters more than people realize. But here's where most people go wrong, and this is critical. They either turn guava into juice, stripping away the fiber, or they eat it with salt, sugar, or spicy seasoning, which completely cancels out its benefits. Guava works not because it's exotic or medicinal, but because it supports the body's natural rhythm when eaten whole, slowly, and in the right portion. And there's something else worth noticing. People who reintroduce fiber-rich fruits like guava often report better digestion within days. When the gut moves waste efficiently, the kidneys are no longer forced to compensate. Think of it as shifting some of the burden away from the kidneys before damage accumulates. This is why guava isn't just a fruit, it's a signal that kidney protection isn't always about restriction, but about smarter choices that reduce internal stress from multiple angles at once. But knowing that guava is beneficial still isn't enough, because inflammation doesn't come from one source alone, and there's another group of fruits that work in a completely different way, quietly calming damage that most people don't even realize is happening. When people finally understand that fiber can ease the kidney's workload, they often think the job is done. But there's another silent enemy the kidneys face every single day: chronic, low-grade inflammation. And this kind of damage doesn't announce itself with pain. It works quietly deep inside the tiny blood vessels that keep your kidneys alive. That's where strawberries and mulberries enter the picture. I once met a woman in her late 50s who said something many people will recognize. She told me, "I don't feel sick. I'm just tired all the time." Her labs were borderline. Nothing alarming. But when we looked closer, the pattern was clear: persistent inflammation, slowly stiffening the small vessels that feed her kidneys. She wasn't eating poorly, she was just missing the foods that calm inflammation at the cellular level. Strawberries and mulberries are rich in anthocyanins, the natural pigments that give these berries their deep red and purple color. These compounds are not just antioxidants, they actively reduce inflammatory signaling in blood vessels. That matters because kidney function depends on healthy microcirculation. When those tiny vessels become inflamed or damaged, filtration efficiency drops long before symptoms appear. Multiple nutritional studies have shown that higher intake of anthocyanin-rich fruits is associated with lower levels of C-reactive protein and oxidative stress markers, both of which are strongly linked to kidney and cardiovascular decline. In simple terms, these berries help keep the kidney's delicate filtering system calm instead of constantly irritated. But here's what most people never hear. Strawberries and mulberries don't work by boosting anything aggressively. They work by quieting the background noise, the inflammation you don't feel, but your kidneys deal with every hour of the day. That's why they're especially valuable for adults managing blood sugar, blood pressure, or age-related fatigue. Of course, preparation matters. Fresh whole berries, not sweetened, not blended into sugary drinks, deliver the fiber and polyphenols your body actually needs. Eaten slowly, they support both gut health and vascular health, creating a ripple effect that reaches the kidneys without overloading them. And there's an important transition here. When inflammation settles and blood flow improves, many people notice something unexpected. Their digestion starts to change. Bloating eases. Regularity improves. And that's not a coincidence, because the next factor that determines kidney stress isn't just what you eat, but how efficiently your body eliminates waste. But knowing how berries calm inflammation still isn't enough. Because even with the right foods, if waste lingers too long inside the body, the kidneys pay the price. And that brings us to the next overlooked piece of the puzzle. Once inflammation begins to calm and blood flow improves, many people expect their kidneys to suddenly feel better. But that relief often doesn't last, and here's why. Even when inflammation is under control, the kidneys can still be overworked if waste isn't leaving the body efficiently. This is the part almost no one talks about, and it's where dragon fruit plays a surprisingly important role. I remember a man in his early 60s who came in frustrated. His diet looked clean, his sugar was stable, and his blood pressure was acceptable. Yet he felt constantly heavy, bloated, and tired. His kidney numbers weren't crashing, but they weren't improving either. When we traced the pattern, the issue wasn't what he was eating, it was what his body wasn't letting go of. Dragon fruit is rich in soluble fiber, which helps soften stool and support regular bowel movements without irritation. That may sound unrelated to kidney health, but it's not. When waste lingers in the digestive tract, toxins are reabsorbed into the bloodstream. The kidneys are then forced to filter what should have already been eliminated. Over time, that extra burden quietly accelerates kidney fatigue. Clinical nutrition research consistently shows that improved gut motility and higher fiber intake are associated with lower uremic toxin levels and reduced kidney workload, especially in older adults. In simple terms, when the gut does its job well, the kidneys don't have to overcompensate. What makes dragon fruit unique is how gently it works. Unlike harsh laxatives or overly stimulating fibers, it supports elimination without cramping urgency or dehydration, all of which can actually stress the kidneys further. That's why many people notice subtle but meaningful changes within days, lighter mornings, less bloating, and more consistent energy. But here's the mistake that cancels everything out. People eat dragon fruit straight from the fridge late at night or in excessive portions. Cold temperatures and overeating can slow digestion and blunt its benefits, especially in older adults. Prepared properly in moderate amounts, dragon fruit becomes a kidney-friendly ally instead of just another fruit. And there's a bigger connection here. When digestion improves, fluid balance shifts. The body starts handling water differently. For some people, this is when swelling reduces. For others, it's when medication interactions become more noticeable. That's because the next factor affecting kidney health isn't just elimination, it's how fats, fluids, and medications interact in the bloodstream. But understanding digestion alone still isn't enough. Because there's another common fruit that helps some people dramatically and quietly harms others, depending on one critical detail most viewers have never been told. As digestion improves and the body begins to release waste more efficiently, many people expect kidney numbers to finally stabilize. And sometimes they do. But for others, progress suddenly stalls, not because of toxins or inflammation, but because of something far more common and far more overlooked, what's circulating in the blood alongside medications. This is where grapefruit becomes both powerful and dangerous. I once worked with a patient who was doing almost everything right. He had adjusted his diet, improved his digestion, and even lost a bit of weight. Then almost unexpectedly, his kidney markers worsened. He was confused. Nothing had changed except one thing. He had started eating half a grapefruit every morning, believing it was a heart-healthy choice, and in many cases it is, but not for everyone. Grapefruit is well known for its ability to lower LDL cholesterol and improve lipid metabolism. When blood fats decrease, the kidneys often benefit because they're no longer filtering thick inflammatory blood. Studies show that improved lipid profiles are associated with slower progression of kidney and cardiovascular disease, especially in people over 50. However, and this is critical, grapefruit contains compounds that interfere with cytochrome P450 enzymes, which are responsible for breaking down many common medications. This interaction can increase drug concentration in the bloodstream, sometimes dramatically. Blood pressure medications, cholesterol drugs, and certain diabetes treatments are among the most affected. When medication levels rise unexpectedly, the kidneys may be forced to filter higher concentrations than intended. Over time, this creates silent stress. The person feels normal, but inside the kidneys are working overtime to compensate for a chemical imbalance that wasn't supposed to happen. This is why grapefruit is not simply good or bad, it's conditional. For people not taking interacting medications, it can support metabolic health and reduce kidney strain indirectly. For those on daily prescriptions, it may quietly undo months of careful progress. The solution isn't fear, it's awareness. Knowing when grapefruit helps and when it harms can mean the difference between supporting kidney function and unknowingly accelerating decline. And this is exactly why one-size-fits-all nutrition advice fails so many adults. There's also a deeper lesson here. Kidney health isn't just about food quality. It's about timing, context, and interaction, how foods behave inside a real body with real medications and real history. But even when you avoid harmful interactions, and even when blood fats are under control, kidney health still depends on something far more foundational. There's one final fruit that doesn't create dramatic changes, overnight, doesn't interact with medications for most people, yet quietly shapes kidney resilience over years. But just knowing that won't be enough, because how you prepare it may matter more than the fruit itself. After learning that some fruits help or harm depending on context, many people ask the same question: is there anything safe, something steady, something I can rely on every day? And this is where apples quietly stand apart. Apples don't promise dramatic overnight results. They don't feel medicinal. They don't create a sudden drop in numbers that makes headlines. And that's exactly why they matter so much for kidney health. I once spoke with an older patient who said, "Doctor, I don't feel worse, but I don't feel better either." His labs were stable, yet his energy never returned. What we found wasn't a missing medication, but a missing foundation. His diet lacked one thing: kidneys need long-term, consistent, gentle detox support. Apples, especially when eaten with the skin, are rich in pectin, a soluble fiber that binds waste products and excess toxins in the gut before they ever reach the bloodstream. When fewer toxins circulate, the kidneys don't have to filter as aggressively. Over time, that reduction in workload is what protects kidney tissue from slow cumulative damage. Research has shown that diets higher in soluble fiber are associated with lower uremic toxin levels, better blood sugar control, and reduced cardiovascular risk, all of which directly influence kidney outcomes in older adults. This isn't about spikes or crashes. It's about stability. But here's where most people unknowingly sabotage the benefit. They peel the apple, completely throw away the skin, or rinse it too quickly and assume it's clean enough. The truth is, the skin is where the pectin lives, and how you wash the apple determines whether you're gaining protection or just eating flavored sugar. Proper cleaning matters. A thorough rinse, gentle scrubbing, or a short soak in clean water can remove surface residues without stripping away the very compounds that support kidney health. Prepared correctly, apples become one of the safest, most consistent fruits for long-term support. There's also something subtle but powerful here. Apples help regulate blood sugar without triggering sharp insulin responses. That steadiness protects the tiny blood vessels inside the kidneys, the same vessels that slowly fail when sugar swings become routine. This is why apples are often underestimated. They don't shout, they don't shock. They support quietly day after day, forming a nutritional safety net that kidneys depend on as we age. But knowing which fruits help isn't the final answer, because even the best foods can fail if eaten at the wrong time, in the wrong way, or in the wrong amount. And that final detail, the one almost no one talks about, may be the single factor that decides whether kidney function stabilizes or slips beyond recovery. Before we end, I want you to remember something important. If you're watching this and feeling concerned about your kidneys, that means you're paying attention, and that already puts you ahead of where most people start. Kidney health doesn't disappear overnight, and it doesn't come back with one perfect meal. It improves through small, consistent choices made with understanding rather than fear. You don't need extreme diets. You don't need to cut everything you enjoy. What your kidneys need most is balance, awareness, and time. The right foods eaten the right way can reduce strain, calm inflammation, and give your body a chance to stabilize, even if you've been struggling for years. If this video helped you see your daily habits more clearly, please save it so you can come back to it when you need a reminder. And consider subscribing to the channel, because every week I share clear, practical medical insights designed to help you protect your kidneys, manage blood sugar and age with strength and confidence without confusion or misinformation. And most importantly, don't lose hope. Many people believe kidney decline is inevitable, but that's not the full story. With the right knowledge and steady care, it's possible to slow progression, preserve function, and live well for many years. Take care of yourself. Your kidneys are working for you every single day, and with the right choices, you can work for them too.